So what I have given?
How many population will be covered by one primary health center?
Primary health.
Okay. The next is it act as a referral unit for 6 sub-center. That means 6 sub-center ka cases can be handled by one primary health center. Remember that. Okay. Next thing is they used to refer the cases to the community health center. Community health center is nothing but those are the civil, okay, civil hospital, 30 bedded civil hospital. Whenever you go to any hospital, you just check, and over there it used to written what is primary health center, also it will write sub center also, and even civil and community or community health center also. So these are the practical and real pictures you can see and correlate with the theory what you are studying. It covers a population of 30,000 in plain area and 20,000 in hilly area, hilly and tribal area. So now you have to go and search the things for one sub-center, how many population, one primary health center, how many population. This one already I have mentioned, still I am asking because I want to you guys to check by yourself in books. Okay, and there means in population 30,000 for plain area, but if it is hilly area, that 20,000 people can use that your one primary health center. But in plain like where we are staying, there 30,000 people can use one primary health center. And referral cases, any cases which they are not able to handling, they will go to the sub center first, then they will go to the primary health center first. Still, if the primary health center is not able to handle the cases, they will refer the cases to the civil hospital or community health center. There are 4 to 6 beds for patient, and some diagnostic facilities are also available. So when you will come back, you will get a posting now how your senior is getting. So in during that posting, you can see in primary health center there are not too many beds. Okay, there are 4 or 6 beds. After that, what happened? There are some little diagnostic facilities like laboratory tests, malaria blood tests. They used to do the blood test, remember, like that they used to do the blood test, not other tests. And they will have some small tests, if you have a cut injury or any kind of injury, they will have those STs and all facilities. So not that much facilities, but those facilities are quietly available for the people who you can give a primary care. So go to the definition. The primary health center is the basic structural and functional unit of the public health services in the developing countries to provide accessible, affordable, and available primary health care to people. Or primary health centers sometimes referred to public health centers. Now clear with this definition?
Yes, ma'am.
Okay, so
Yes.
these are the words you have to remember. The people,
Yes,
it should be
ma'am.
easily accessible. It should be affordable by the people. See, if you go to a pharmacy, one ORS packet, they may take the price what it is written, okay, or they may increase the price. But if you go to a primary health center, those ORS packets are completely free for you. Okay, primary healthcare, in primary healthcare, many things are there which is completely free of cost by the providing by the government. Okay. Next is the principles. The principles are reducing exclusion and social disparities in health, organizing health services around people needs and expectation. So here what happened, they always try to disparities of health means in our one class we have mentioned we used to provide the care without seeing that their ritual, their caste and all this. So even primary health care also used to provide the care based on all those. And even they used to organize health service like free camp for the people. When they have seen that people are not aware on any kind of diseases, they can conduct the those camp free of course. If it is in villages on all, if it is free of course, people will easily come and they will access those facilities given by the government. The next is integrating health into all sectors. All sectors means here any kind of cases, maybe it a pregnant case, maybe it is injury cases, maybe any kind of non-communicable disease like diabetes and hypertension, all kind of diseases everywhere they can integrate. Any case does not matter what specific cases, all type of cases can go for getting the primary care. But if it is severe, that they need to refer the cases. Pursuing collaborative models of policy dialogue, and this is some kind of like they have some models, they have some model given by the government. Under that, like we have ASA worker, you know ASA workers.
Yes,
Yes,
ma'am.
ma'am.
What is ASA meaning?
Yes.
What is the meaning of ASA? Okay, that also you have to check today. Okay, guys, will you
Yes,
check?
ma'am.
Okay, ma'am.
So
Yes, ma'am. Yes, ma'am.
always in my class, sit with pen and paper. Okay.
Ma'am,
Hmm.
Asha means hope, I guess.
Uh-huh.
No, ma'am, are they the workers who like go in the community
Yes, you know that
section
concept,
for
but
the
there is a
polio?
specific full form of ASA.
Oh,
Okay,
okay.
today you have to find it out. So like here they are telling pursuing collaborative models of policy dialogue. We have some policies. That's why in my starting of the class, I mentioned about the 108 under NRHM. NRHM have some policy. Every program, every committees have some policy. Under that policy, they used to train people. You know ANM training, GNM training, ASA workers training. You heard about that, right?
Yes,
Yes,
ma'am.
ma'am.
So
Yes,
those
ma'am.
used to come under some model. Those used to come under some policy. So these things also handled by the primary health center. Clear with these principles?
Yes, ma'am.
Okay. Leadership
Yes, ma'am.
reform, that means yes. So health workforce development, community participation. Community participation, you know, only any type of cases, any kind of collaboration, the primary health center have to work with them as a team. Health workforce development. Health workforce development means, see, sometimes what happen in a village, just imagine there is a sub center or there is a primary health center. Sometimes what happen, the ward boy, the mali, the workers, they are from that village only. So what happened, this primary health center people or the team, they can encourage them to work, okay, for the workforce for their own areas. The ASA, the ANM, they used to go places and they used to teach the people. They used to do the survey. So with that, they also encourage the people who are there. They also encourage the people about the how to keep our health positively, how to keep our health healthy, and in a positive state, how to we have to live. So these are the kind of things they try to develop under the principles of primary health center. Come to the objective: to provide comprehensive primary health care to the community at primary health centers. So always remember, primary health center try to provide always comprehensive care, which is easily affordable, accessible. We already mentioned about that. Next is to achieve and maintain an acceptable standard of quality of care. Acceptable standard means, remember, in healthcare we don't have any things like that this Hindu people can do, this Christian cannot do, or we can achieve that, these people can, like discrimination. There is some certain standard which everybody have to follow. Okay, when protocols came, we are not seeing anything, it's equal for everybody. So we have some standard, like in immunization, every houses, every kid, they should get 100% of the immunization. Those are some standard which is already maintained by the primary health care and primary health center or the government. So the standard for providing a quality care, everybody have to do that and everybody have to achieve that. It's not only about the maintaining, it's also about whether they achieve or not. So now I think you have seen there is a vehicle, it's named Adarani. Have you seen?
Yes, ma'am.
Yes, ma'am.
Okay, what they used to do?
They provide services for the mothers, for the
Yes,
newborn, ma'am.
the delivery, okay, from escorting from the delivery period to after the delivery. Even they used to came, even returning the mother and baby till home, right? So these are the some services under the primary healthcare. Now we have some programs like Adarani 108, even Mamoni, Mazoni, before all this we have. So these are nothing but these are some kind of services to maintain the quality care. Okay, these are some standard, they won't discriminate anything. This is for everybody and this is acceptable by everybody. Next is to make the services more responsive and sensitive to the need of the community. So when there is a primary health center, everywhere you can observe there is a one ASA worker, there is one ANM worker, maybe there is a GNM worker or BSc. So that time what happened? Wait a second. Okay. Okay, so that time what happened? To make the services more responsive and sensitive to the need of the community. So these are the things, they are very responsible, they are sensitive, they are then based on the need of the community, they used to provide the cares. Next is function. What this primary health center used to do actually? The primary health, they used to provide all type of medical care. They used to provide treatment and prevention of endemic disease. Endemic is what? A disease which is covering in a specific area. Okay, that is endemic. Maternal and child health care. Maternal and child health both is the together care. Whether there is a pregnant lady, antenatal lady, they used to go for check-up and all after even her birth of the baby also. They used to provide all the treatment to the baby, all the care services to the baby. And both mother after delivery. Health education, they used to teach them what she have to eat, how she have to maintain the immunization schedule, everything related to everything. Health education used to provide by the primary health center. Referral services, already I have mentioned, if there is a cases of fracture, okay, they can give treatment for the fracture as a pain relief, or they can bandaging and all. But if it is a inside or okay internal bleeding, internal fracture, or internal any kind of problem, that primary health center cannot handle that case. So with some proper formality, they have to refer the cases, any kind of cases. If they are not able to handle, out of handling, they have to provide refer that cases to the other hospitals or the higher hospitals, like district hospital, like civil hospital. Okay, so those are the referral services they used to carry. Next is basic laboratory test. Already I have mentioned the primary health center, they used to have some laboratory test facilities, like they used to collect the malaria blood smear. They used to collect, now they are doing the COVID, even COVID test also. And they used to have those facilities like for based on the primary care of that area's need. Okay, if that area ka people are suffering more in cholera or any kind of disease which is because of waterborne disease, okay, so they will do tests for that. They have the laboratory services for that. So based on the endemic condition, already I have mentioned, so based on the endemic condition, they used to do all the laboratory tests. But they used to have the laboratory test material and laboratory technician also as well. National Health Program. National Health Program like NRSM. NRSM is on the National Health Program. The World HIV Day. Like this 1st December is World HIV Day. So this primary health center can conduct some program. They used to they publish some like any kind of magazine, not on magazine, sorry. They can provide the services like they will teach the ASA. The ASA will go to the people and they will teach the people who are coming for outpatient department, and they can teach about that. Like these are under National Health Program, all the services used to be there. Like we have ICDS, we have anemia control program. Okay, under anemia control program, they used to distribute the iron tablets. They used to teach the adolescent girls and people who are reproductive age group. So these are the kind of things this